Hello, I'm John Kanellopoulos, an eye surgeon based in Athens, Greece and New York City, New York, director of the LaserVision Institute in Athens, Greece, and clinical professor of ophthalmology with NYU Medical School in New York. I followed the developments in cataract surgery early on, and our group introduced in 1999 cataract surgery with incisions under 2 millimeters. We used at the time the Dodic laser photolysis system, which used YAG laser technology in order to emulsify the lens, and a special Acritec lens pre-folded in order to complete the surgery and intraocular lens implantation in an incision under 2 millimeters. It is my real pleasure several years later to introduce for the first time in Greece laser cataract surgery with a femtosecond laser. Today, March 6, 2012, we were able to complete several cases, successful cases, of cataract extraction with the amazing, fascinating technology of LenSx femtosecond laser. This laser, as you will see, is able to perform the cornea incisions, the anterior capsular rhexis, and the delineation of the lens pieces that will be removed in cataract surgery. I hope you find this presentation interesting. I thank you very much for your attention. Okay, here we go with our case. We're applanating on the patient's cornea. You can see here suction is built up now, and we will adjust first the limbal position according to our plan. And this is done already. Now I'm adjusting my side cut at the 8 o'clock position, taking it out to the limbus. Now my main incision, again, taking it out to the limbus. This is at the 4 to 5 o'clock position. Now we're adjusting the capsular rhexis. We have a very nicely dilated pupil, so I'll enlarge the capsular rhexis from 5 to 5.5 millimeters, and also my lens fragmentation. We're on live OCT now, and we're seeing all the measures: cornea thickness, lens thickness. We're adjusting for the higher and lower lens thickness. As you can see here in the bottom right, we will enlarge the dissection of the lens with a femtosecond laser. It's the yellow area that you see. Obviously, it has to match the opening of the capsular rhexis. And now we're looking at cornea detail and adjusting my two-step incision by determining these parameters. We're back on the patient's eye. We approved all these measurements, and we're going on real time now to show you how this technology will perform. First, as you see now, a linear capsular rhexis. All the little bubbles is the machine working right under, through, and a little bit over the capsule to perform that 5.5 millimeter capsular rhexis that I mentioned before. And now we're performing the lens fragmentation. 3 intersecting lines will separate the cataract in 6 symmetrical pieces, and then a circle at around 3 millimeter diameter will further dissect the lens in a cylindrical fashion from the center. You can see the breakthrough bubble here coming out from the cataract just under the anterior capsule. And then we'll see our main incision after this part is completed. So focus now on the 4 o'clock position. You can see the bubbles in the anterior chamber as the main incision is performed from inside the anterior chamber coming out. And you see the precision of this tool coming right out to the limbus. This is a 1.8 millimeter wide and incision and the side cut, and we're done. So back in the operating microscope, marking the 170-degree axis, we will obviously use a toric lens in this patient that has significant preoperative cornea astigmatism, about 1.8 diopters, both measured by the biograph and the cornea tomography maps. I'm using Viscoat here to fill the anterior chamber, protect corneal epithelium, and obviously remove all the bubbles that were created during the femtosecond work. We're going in with a cystoscope and carefully making sure that the curvilinear capsular rhexis is performed 360 degrees around. Visualization is kind of poor due to the dense cataract, but you can see how easily now with my forceps I'm just pulling away the anterior capsule, and the capsular rhexis is done. Fluid to perform hydro dissection, and we're very careful with this step not to blow the air that's possibly behind the cataract into the posterior chamber. In the eye with the phaco tip, and you can see how it easily it is to break and dissect the pieces of the cataract that have been pre-chopped with the femtosecond laser. We're down to the last two pieces, and you can appreciate here that this is a real dense cataract. But the ease with which it's removed is remarkable. Very reduced energy on the phaco, and we're finishing here with removing the cortex. This is the Alcon toric lens. You see it's a plus 25, so really hyperopic eye, a small eye. Nevertheless, procedure was of great ease. The lens is placed in the Monarch cartridge, and then we will place the cartridge easily through the 2.8 millimeter incision. I mentioned the length of the incision is 1.8 millimeters, and I'm torquing the lens here to start getting the orientation of the 170 degrees that we want to match on the cornea astigmatism. Removing with irrigation aspiration the residual viscoelastic. Here is Myocol to attain meiosis, and this is Resure, an ocular polymer bandage that will ensure tight wound closure and no ingress. I thank you very much for your attention.